Bismillahirrahmanirrahim. My name is Dr. Niqad Ahmad. I'm a resident neurosurgeon from LRH Peshawar, Pakistan. I am very grateful to the IWBNC committee for giving me an opportunity to present my research article to this neurosurgery congress. Thanks a lot for giving me such an opportunity. The title of my presentation is Incidence of Skull Fracture in Children Presenting with a Brain Contusion. Traumatic brain injury, which is a big health concern not only in Pakistan but also all over the world. And majority of patients presenting with traumatic brain injury belong to 16 years of age. The literature shows that falls is the most common mechanism of traumatic brain injury, followed by RTA and assault and instrumental delivery. In Pakistan, the morbidity and mortality due to traumatic head injury is very high. A retrospective study shows that fall which is 65%, is most commonly in mechanism of head injury in pediatric patients, followed by RTA, which is 22%. The skull fracture alone has not a great impact on the disability, but association with contusion has worse impact in children. In clinical practice, traumatic brain injury is more common in children than adults in Pakistan. The objective of the study is to determine the incidence of skull fracture in children presenting with a brain contusion. This was a cross-sectional prospective study done from July to December 2020. The sampling technique was non-probability consecutive sampling technique, and 100 children were the sampling size with the inclusion criteria from 6 months to 14 years. The children with gunshot injury, penetrating head injuries, and lesions other than hematoma were excluded from the study. So the traumatic brain injury were more common in male, which was 72% with a median age of 84 months, followed by females, which were followed by 28% in females with a median age of 60 months. So the most common age presentations were at 5 to 10 years of age with 43%, and under 5 years of age this was traumatic brain injury presentation were 37% with 11 to 14 years and 19.4%. So the most common cause of trauma were fall and followed by RTA with a slight variation, and in both the male to female ratio were about the same in both fall and RTA, but in assault, which was the least common mechanism of injuries in traumatic brain injury in children, but the female ratio were more high in that condition. The most common site of contusion is parietal region, which is 36%, followed by frontal lobe, which is 30%, and occipital 11%, with 8% in temporal region, and basilar region was 7%. So the median GCS at the time of presentation was 14 by 15, and the minimum GCS which was recorded in 4 cases were 10 by 15, and the children with a brain contusion, 89% diagnosed with a skull fracture, and the median age of these were 72 months. And out of the skull fracture, the linear skull fracture is most common, which is 67%, followed by a depressed skull fracture. The study concluded that traumatic brain injury is high in children with a skull fracture. So the most common mechanism in this is fall, followed by RTA and assault. Though linear skull fracture is more common in traumatic brain injury than depressed skull fracture. The timely diagnosis and early management can help preventing the late neurological complications. So the closer follow-up is recommended so that to prevent delay in diagnosis of internal brain injuries. So this shows concluded that the clinicians should have to develop a standard protocol for the assessment of children with a brain contusion in emergency department at the site of trauma as well as in the home to make a protocol to prevent this site of trauma in children. It will help in decreasing morbidity and mortality, and this study has a limitation, which is a single center study in the same small sampling size, so need to have a multi-center studies with a large sample size to determine the actual magnitude of the problem. Thanks a lot for giving me a nice time. Have a good day. Stay safe. Thank you. Goodbye.